specific EMR that's made it pretty seamless, but still.
See, that's part of the issue is the EMR, it's the hospital's choice to select the EMR, not the physician's. And
Well, Banner uses, yeah.
I think they're
Cerner,
Cerner
yeah.
or Epic, and depends on which hospital, but they don't purchase all the bells and whistles.
Right.
So, you know.
Because they're expensive and.
Yeah, yeah.
All right, dear. So this is just a little drape, okay? Misfired. Now you shouldn't feel anything. You will feel pressure, okay? But it shouldn't be painful, all right?
Okay.
So you let me know if it is at all, okay?
Okay.
Okay, dear. Any pain at all?
No.
No? Okay. I'm just going to kind of pull on your skin a little bit. Just bear with me. How you doing, okay?
Mhm.
No pain?
No.
Feels weird though because you can feel me, right?
Kind of. I can't really feel anything.
Okay, good. Are you off from school?
Yeah.
Today was the last day of finals.
Oh, yay. So what grade are you in?
I'm a freshman.
Freshman. Where do you go to school?
Wally Grove.
We live all the way down in like the Green Valley, Sowetita area.
Oh, gotcha.
Yeah.
Oh, sorry, we probably couldn't get you in that office, could we?
Yeah, everything was booked this week.
You're doing great. Mom gonna show this to you then?
Yeah. So I filmed the last one and she watched it a couple times. So
Yeah.
She's like, you gotta film this one. All right.
So what are you guys doing for Christmas? So you said you're going to California, is that what you said?
Yeah, we're leaving tomorrow. We're going to California for like 4 or 5 days with family.
Uh-huh.
And then we come back to Phoenix, and then my son here has a baseball tournament for 3 or 4 days.
So you guys driving to California then? Or?
Driving to California, just Southern California,
Oh, that's not
Orange
too bad,
County
yeah.
area.
All right, my dear, it is off.
That's insane. You have a big piece of flesh missing, Kelly.
That's great, huh? If you want to pause, I'll tell you when to start again. That way you're not like wasting your video there. So we're going to read just a minute, kind of grab what we... So you can see what the little, it's much wider than when we took it off because she's got healthy skin, so it kind of pulls on it.
Right.
So it creates this really wide defect.
Right.
They get that ready. I'm going to just, this is something we call undermining. So it allows us to kind of pull the skin. It moves a lot more. It takes some of the tension off.
Makes sense.
You know what? I think, Nisha, can I take some 3O monochrome? Thank you, dear. Yes, please. Sorry, you might feel a little dripping.
Okay.
It's just some fluid, I like to say. Thank you. You can stay and watch if you want, Nisha, if you want to, but you may not want to. Yeah.
What are we taking out?
So it was a melanoma in situ, so just on the surface of the skin. So the buzzing you hear is just me sealing over the blood vessels. Do you want to play by play or not really?
Doesn't matter.
Okay. Look straight up if you will. There you go. So there's that vessel there. Come over here. Good. There. You can relax. Oh, that's good. Great. All right, now we'll put you back together. How's that sound? Pretty good, huh? Again, you may still pulling and tugging, but nothing painful. Is that okay there?
Yes.
Okay, good. So we put 2 layers of stitches in. And this takes the initial tension off the wound. So we get it. Lots of pulling, dear. You okay?
Yeah.
I got your digits to on either side, Allison. No. Hold, push on either
Oh.
side. Yeah. We're going to use you as a bit of a table. Allison's going to push on you just a minute. Thank you.
It's been so long since I've done an excision with you.
I know, right? Especially this one crying a big 3-0. You know?
Yeah.
So it's going to be super tight back here, dear. And so, you know, I don't know if you're planning on doing any like big hikes or anything, but you probably won't want to. I don't know if you would like bike or run or anything, you know. I would definitely wait a couple of weeks before doing any of that.
Okay.
How about a lot of walking?
Fine, just let your body be your guide. You know, if it's uncomfortable or you feel like it's pulling, then don't. More push in. You ready, dear? Oh, yeah. I'm going to test Allison's strength here. It's amazing what just 2 stitches can do, huh?
Yeah.
Yeah. Strong.
The skin is very stretchable, if that makes any sense. And so you can actually, in some areas, we just will actually put big stitches in just to pull it closer together and wait about 10 minutes, and then we can manipulate it even more.
Well, yeah, once you've been pregnant with 3 kids,
You're
like,
right,
All the
exactly.
skin just stretches.
So where are you in the mix there, Miss Kelly? It's Kelly, right?
Yeah.
Are you number 1, 2, or 3? Oldest or youngest or middle?
You're the oldest.
Oldest?
Oh.
Kelly's my first.
Got it.
And my son here is the second. And then we have a little one, a 10-year-old girl.
Oh, okay.
Yeah.
So cute you call her your little one and she's 10. Everybody
Not
always...
anymore, but for the longest time I was like, where's the baby?
Right,
Where's the
I know.
baby?"
I still call my baby, who's 4, the baby. And
Yeah.
someone the other day was like, it's so cute that you still call him the baby. I'm like, he's going to be my baby forever.
Does he say I'm not a baby?
He does. He does. He says, I'm not a baby, I'm a big boy. So sometimes when he acts out, I'm like, remember, you're a big boy,
Yeah.
not a baby.
My brother still calls me his baby sister. I'm
Oh,
like,
that's
oh, Matthew, I'm an adult now.
How you doing up there? Good?
Mhm.
Not too bad?
No.
Especially since you're not sure exactly what's happening, right?
Yeah.
The other thing that happens with these when we do take them out is you end up a little bit with a divot. Like if you look from a profile, it'll look like it dips down because you see we took that layer of the fat. Even though it was all even all around, it still
Right.
comes together sometimes with a little divot. That all goes away when it's all done.
Okay.
But sometimes patients are like, that looks funny from this, you know, a side angle, but
Right.
it's not permanent. It always more commonly does that on the legs than anywhere else. Again, mostly from the tension that's there. So you can see we put a lot of these kind of deeper stitches in. How you doing, dear? Okay? Good. But that's because these will dissolve after 6 months or so.
Mm-hmm.
And so they really help hold it together and prevent it from spreading open and things like that. And the top layer just ends up being kind of what we call a finessing stitch. So this is that tagging of the specimen I was telling you about. We're almost done. The deep stitches take the longest, so I'm just gonna put a couple more in and then we'll do the top layer, which won't take long at all. Let me open that up for you, Sherry. Please, thank you.
And where did you tag it?
Superior. The only thing tricky about the suture is I use the same suture for the top, and so it's clear,
Mm-hmm.
so it may be a little hard to see, but
Okay.
if you have any problems, you know. But I actually probably wouldn't mind leaving them in a little longer,
Okay.
just because you saw how tight it was.
Yeah.
Sorry, she's like screaming. That's
all right.
because
No,
most
no,
of our
no, no,
patients
sorry.
are like 70 and older.
Yes.
You're what, 14, right, dear?
Yeah.
Come back here. I see it.
Did I just make it worse? There you
No.
go.
Thank you. And the other purpose of these deep stitches is to make
Is
it
this one
all the
deep?
way down. Is to evert the skin edges a little bit. We like them to kind of pucker up and kiss, because then when the stitches come out, it lays nice and flat.
So how much pain will she be in afterwards?
You know, she might be tonight uncomfortable because
Mhm.
it's going to be tight.
Okay.
I don't know. Have you she ever taken any pain medicine?
Just
Like
ibuprofen.
I mean,
You know.
you can certainly try ibuprofen. I don't know that it's going to be enough because it will be uncomfortable, I think.
Mm-hmm.
I usually will give you a prescription for something like a little Vicodin or something with a little narcotic in it. It'll make her kind of sleepy, but obviously just one pill for her.
Right.
And I'd rather you have it than not have it, so
Okay.
that if she is uncomfortable, you know, you're not, because I can't call it in.
Right.
So I'll write you a prescription for it just so you have some.
Okay. But like icing or
Not really.
No.
Elevation is key.
Elevation.
So, you know, so when you go home, just elevate the leg so there's no inadvertent swelling
okay.
that occurs. The first 24 hours is the worst because it's that's how, you know, it takes that long for the skin to kind of stretch. And put one more.
Oh, sorry.
That's all right.
Dabbed a little too hard.
That's all right. And put one more here, and then that one came out. So, so just 2 more deep ones, dear. We're almost done.
Do you need another kind of suture for that?
No, I think I got enough. Thank you. I tend to put a lot of stitches deep. Some people don't, but I think it really does help prevent the spread of the scar. All right. This one. One more up here. These knots will sometimes unravel, that's why they... This is the last deep stitch, dear, and then we're... I don't want that. I didn't pull through, did I? I did. Trying to grab that other one.
Yeah.
I think she fell asleep. It'd be nice. I've had a few patients fall asleep on me.
Yeah, have you?
When I worked in the ER, like kids after they have lacerations, we'd numb them and then kind of papoose them, you know,
Right.
to do repairs, and they would go sound asleep
Right.
once they threw it, because they were so exhausted from the whole process. And then we burrito wrap them, and then they're like, "Yeah, we're done."
It's nap time. Sounds good right now.
I don't know what it is. There's something about a doctor and a dentist's office that as soon as I get there, I'm just really calm and I want to go to sleep.
Oh, really?
Yeah.
That's good.
All the way down.
I literally could sleep while they were cleaning my teeth or whatever.
Oh my gosh.
Oh my
I
goodness.
wish that was that way.
I know. I have to get gassed when I go to the dentist. I can't handle it.
You doing okay, dear? No pain? Sometimes once I get to the top layer, the medicine's all gone deep and it's not as effective on the top surface. Actually came together pretty nicely here, dear.
Yeah, looks good.
See, now you can appreciate the before and after with your video here, whereas
Yeah.
patients will be like, "Oh, that doesn't look great," but when you see what it what it was, then they're like, "Oh, okay."
Yeah.
So you can see this is a kind of a baseball stitch, we call it, so it's kind of looping over, so that may be where it's a little tricky. But the big thing is you basically you can cut like every other strip and then it just unravels.
Okay.
And there's a knot on either end then. So it's Wednesday, so maybe like Friday, if you want to take them out, Friday or Saturday.
Okay.
I think Monday's going to be a little long. Or if you feel like, gosh, I don't know if they're ready, just wait. It's not a huge deal.
Okay.
It's just distracting.
Me too.
It's not right there. I couldn't get to it. Put so many deep sediments. So like I said, the deep ones are supposed to dissolve in about 4 to 6 months. Sometimes your body sees them as foreign and will kind of spit them out. And if so, like if you feel like, you know, there's some stitches coming out, let us know. Dr. Nelson is retiring, so if you're okay with it, I'll probably just assume your skin check care.
Okay.
And usually after you've been diagnosed with a melanoma, usually in the mature population, you
Yeah.
see it every 3 months or so for the first year.
Mm-hmm.
And I probably would still do that in you just to double check, and then we can go 4 months and then, you know, 6 months. And just because you've had one, you are at risk of getting another one. But I think this is a unique situation in that it was in this congenital mole. So
Do you ever go down to Green Valley, or you?
I do, yeah.
You do?
So we'll
Okay.
schedule that follow-up in
Okay.
Green Valley.
Okay.
How much despair here, Allison.
You always seem to do that, Dr. Yvonne. You made it work.
Sorry, we're going to pull this up here. I'm just going to pull it down so I can see.
Okay, yeah.
Yep, we're done.
Recording.
Yeah.
She's got all these paparazzi filming her.
You're famous. Instagram famous. How many Vicodins do you want?
20 maybe?
20. Thanks, Rach.
Like using the tiniest amount
You
of
can do
suture.
it.
Okay, this is where everybody has to cheer me on to use this little bit of suture left.
Dr. DuPont. Dr. DuPont. Slow chant.
Valerie usually has to cheer me on. I've done these sort of
See, you do it quite often, don't you?
I do.
You cut it close.
Got it there now.
Will it help? Do
Yeah.
you like keeping the needle on, or do you want me to cut
You can cut
the
it
needle
off. Actually, you know what? Keep it on for a second.
Okay.
Just want to do a couple more ones.
I knew
That
you.
took longer than anything, just trying to do that last little bit.
I know. I knew you could do it, though. I believed in you.
Thank you, Allison.
Here, I'll hold it.
Would you like it to follow up in 2 weeks?
No, she's gonna, her mom's gonna take the stitches out, so.
Okay.
Got 4 of them in there. Just leave them alone. Okay. Not despair. Nothing.
Wow.
All right. All right, my dear, you did fabulous.
We just gotta get you cleaned up and bandaged up.
So there it is.
And what are the care instructions?